10 Common Signs of High Cholesterol. Hello everyone. Elevated cholesterol levels pose a significant risk factor for heart disease and stroke, both of which rank among the primary causes of death globally. Shockingly, an estimated 93 million adults in the United States surpass the recommended total cholesterol levels. What's even scarier is that high cholesterol often manifests without obvious symptoms, leaving many unaware of their elevated levels. This underscores the crucial importance of recognizing common indicators that could signal heightened cholesterol levels. Early identification empowers individuals to implement lifestyle modifications and seek medical intervention to lower cholesterol levels, thus mitigating the risk of severe health complications. In today's video, I'll delve into the top 10 signs and symptoms that may suggest elevated cholesterol levels in your bloodstream. I'll provide insights into these symptoms, their correlation with high cholesterol, and guidance on when to seek professional medical assistance. My objective is to impart knowledge on this critical health issue, enabling you to proactively monitor your cholesterol levels and protect your heart health. Without further ado, let's delve into the top 10 prevalent signs of elevated cholesterol. 1. Fatty skin deposits. A prominent indicator of potentially high cholesterol levels is the presence of fatty deposits beneath the skin, known as xanthomas. These raised, yellowish growths primarily manifest on areas such as the eyelids, knees, elbows, and buttocks. Xanthomas develop when cholesterol accumulates in the soft tissue beneath the skin at a rate surpassing the body's ability to eliminate it. These lipid deposits vary in size and may occasionally resemble warts in appearance. The existence of xanthomas serves as a compelling indication that cholesterol levels are alarmingly elevated and necessitate intervention. 2. High blood pressure. A clear link exists between elevated cholesterol levels and hypertension. Excessive levels of LDL cholesterol in the bloodstream lead to the gradual accumulation of plaque deposits along the inner walls of arteries, a condition termed atherosclerosis. This plaque buildup reduces artery diameter, hindering smooth blood flow. Consequently, the heart compensates by exerting greater force to propel blood through the narrowed passages, resulting in elevated blood pressure levels. 3. Chest pain. In the event that a cholesterol plaque dislodges within an artery supplying blood to the heart, it can obstruct blood flow entirely, precipitating a heart attack. Hence, experiencing chest pain serves as an imperative cue to undergo cholesterol assessment. Clinically referred to as angina, heart-related chest discomfort typically manifests as uncomfortable pressure, squeezing, fullness, or pain localized in the chest's central region. Occasionally, this sensation may extend to the jaw, left arm, or upper back. Elevated cholesterol levels heighten the risk of plaque accumulation and blood clot formation. Therefore, any recurring or unexplained chest pain warrants prompt medical evaluation. 4. Rapid heartbeat. Elevated cholesterol levels impose added stress on your cardiovascular system. As arteries become obstructed with cholesterol deposits around the heart compensates by intensifying its pumping action, striving to propel blood through the constricted passageways. You might experience sporadic palpitations or a rapid, irregular heartbeat when cholesterol impedes blood flow to the heart, an occurrence medically termed as arrhythmia. Although anxiety or caffeine consumption can also trigger accelerated heartbeats, persistent occurrences may signify an underlying issue with your heart. Consistently elevated resting heart rates exceeding 100 beats per minute could be associated with high cholesterol levels. 5. Erectile dysfunction. Here's a significant point, particularly for men. Constricted arteries restrict blood flow to various parts of the body, including below the waist. Erectile dysfunction occurs when the penis fails to receive sufficient blood flow for an erection to be achieved. Among the leading vascular factors contributing to erectile dysfunction is atherosclerosis resulting from high cholesterol levels. This condition leads to blockages in the small arteries surrounding the erectile tissue, hindering the necessary blood flow for erection. The onset of weak or short-lasting erections may serve as an initial indicator that cholesterol has begun affecting blood vessels, preceding more severe complications. It's crucial not to overlook erectile dysfunction but rather to undergo screening for cardiovascular risks such as high cholesterol. 6. Numbness and tingling. Have you experienced sensations of numbness, prickling, or tingling in your hands, feet, or limbs? These sensations, known as paresthesia, occur when cholesterol plaque restricts blood circulation to the peripheral nervous system. Insufficient blood flow leads to nerve dysfunction in your extremities, resulting in unusual sensations transmitted to the brain. Numbness and tingling sensations in the hands and feet are particularly prevalent during periods of inactivity, such as lying in bed at night or prolonged sitting or standing. These sensations serve as warning signs of potential peripheral artery disease, indicating compromised blood flow to the arms and legs, a risk heightened by high cholesterol levels. 7. Vision issues. Encountering sudden blurry vision, double vision, or vision loss typically signals ocular issues. However, in certain instances, changes in vision can be associated with high cholesterol levels. Here's the rationale behind it. Cholesterol plaques may accumulate over time in the arteries that provide blood to the optic nerve and retina. This process can lead to damage to nerve fibers and small blood vessels crucial for maintaining clear, sharp vision. Vision alterations resulting from cholesterol buildup often affect both eyes equally. Consulting an ophthalmologist is essential to exclude high cholesterol and other potential factors such as diabetes, glaucoma, and macular degeneration. 8. Dizziness. Short periods of experiencing lightheadedness, dizziness, or sensations of the room spinning may not raise concerns. Nevertheless, if these dizzy spells recur frequently, they could be linked to high cholesterol levels and diminished blood flow to the brain. While conditions like vertigo or migraines may also induce dizziness, the presence of neurological symptoms coupled with risk factors for atherosclerosis warrants an assessment for high cholesterol. When cholesterol levels narrow the arteries supplying oxygenated blood to the brain, it results in inadequate nourishment for brain cells. Thus, fleeting instances of dizziness or unsteadiness may signify an early indication that your brain isn't receiving sufficient blood flow due to elevated cholesterol levels. 9. Fatigue. Experiencing persistent fatigue and a sense of low energy, regardless of adequate rest, may signal suboptimal bodily function. Cholesterol plaques impeding blood flow can lead to reduced oxygen delivery throughout the body. Consequently, diminished oxygen reaching muscles and organs may result in feelings of weakness, lethargy, and chronic tiredness. Even moderate physical activity might leave you feeling depleted. Generalized fatigue and ongoing weakness serve as your body's means of signaling an underlying issue. While various factors like anemia and thyroid disorders can contribute to fatigue, it's essential to recognize poor blood circulation and inadequate oxygenation due to high cholesterol as potential contributors. 10. Memory. Certain studies suggest that elevated cholesterol levels, particularly heightened LDL particles, may hinder blood flow to the brain and affect cognitive function. Constricted arteries restrict the brain's oxygen delivery, impairing memory functions. Research has established a notable correlation between high total cholesterol levels in midlife and an increased risk of dementia and Alzheimer's disease in later years. Symptoms such as brain fog, difficulty concentrating, confusion, and forgetfulness could indicate subtle indications of elevated cholesterol levels. Naturally, as we age, memory decline can arise from various factors. Nevertheless, if cognitive changes occur without a clear cause, it's advisable to discuss potential cardiovascular risks with your healthcare provider. If you enjoyed watching this video, don't forget to like, subscribe, and turn on the notification bell, so you don't miss any new videos. Let us know your thoughts about this video in the comments section down below, and feel free to stay and enjoy it until the end. Also make sure to check out our next highlighted video, and we will see you next time. Thanks for watching. Please like, share, and subscribe.